and good afternoon. We are now live with our Lunch and Learn about cholesterol, diabetes, dementia, and death. Now, a lot of people don't understand their cholesterol numbers. And so I want to just kind of give you a brief overview with this. And then we want to talk about, if you are taking medicines, what we want you to take away from this particular lesson today. Okay, so you have three components to your cholesterol number. You've got your total cholesterol number, you've got your triglycerides, your LDL, and your HDL. Now, your triglycerides are a component that tells your doctor your cardiovascular risk. And so we think that that's a really, really important number. And if your triglycerides are off the chart, it could be what you're eating. It could be the way you're metabolizing your food, but the number has a direct correlation to predictable cardiovascular events. So we want to make sure that you look at that. Your LDL is so-called bad cholesterol. It is really, in my opinion, and in a lot of other opinions, it's really not bad. And we're going to talk about that and how having low LDL leads you to dementia. Nobody wants that, okay? And then your high cholesterol, your good cholesterol, your HDL, is a measure of how well your liver is working. So when we have people come into us and they I'm looking at their cholesterol numbers, I'm looking at their overall number. I want your overall number to be around 200, 220. Your medical doctor is going to want your number to be closer to 100. So the problem with that is every single hormone that your body makes is cleaved from cholesterol. So think of a flow chart. Up at the very top, you've got a 28 atom molecule called cholesterol. From that, depending on how it cleaves itself, you're going to have all of your different hormones, not just your sex hormones, your estrogen, your progesterone, and your testosterone. You've got all your other hormones, aldosterone, cortisol, all these other things that are in there. There's like about 28, 29. There's just lots of them, okay? If you don't have enough cholesterol to go around, then you're not going to make any hormones. The second important reason that you need enough cholesterol is because every cell membrane in your body, and you have 70 trillion cells in your body, every one of those cell membranes is made up of what? Cholesterol. So if you don't have enough cholesterol, your body is going to take what you have and it's going to make those cell membranes. And then any extra is going to make your hormones, right? So you've got to have enough to go around. So we're going to talk about this. There's a lot of misinformation out there. There was a study, I think it was called the Framingham study. It was never able to be replicated. But that study told people that if you could lower your cholesterol, that you would be free of cardiovascular risks. Now, I'm going to show you some statistics today that shows that that just never happened. And so a lot of your medical doctors are not looking at the current research or even research over the past 40 years. They learned what they learned. They think that's the way it is. But that study, to the best of my knowledge, if anybody out there knows anything different, then pop it in the boxes. I'm always wanting to learn, okay? But as far as I know, that study was never replicated. And the statistics that I'm going to talk to you about today shows that lowering your cholesterol has had zero effect of preventing cardiovascular events, but it's had a lot of other negative effects on dementia, diabetes, and actual death. And so that's kind of what we want to talk about. So in the United States, 50% of adults over the year of 75 are on cholesterol medicine. They're doing it, as I said, to prevent heart attack, stroke, or any other kind of cardiovascular disease. But there is no evidence stating that that's really a thing. Okay, this is a long report. I'm going to try and get through it in a way that's going to be meaningful to all of us. So you're going to have to move fast because it's a long report. So your LDL stands for low density lipoprotein. All right. So that is the so-called bad cholesterol. In our opinion, holistic opinion, the low density lipoproteins are nature's Band-Aid. They put that in your body lays down that LDL as a Band-Aid to prevent a blowout. I know that's kind of a crass analogy, but when you have a lot of inflammation, you're going to see that your LDL is high. Your doctors are going to say your LDL is high. We need to put you on a statin drug. We know holistically that if we reduce your inflammatory response, that the body will quit making the LDL. Okay, so that's something that you need to know. It's not a bad cholesterol. We don't want it to go out of control. We don't want to not monitor it, but if we see that it is going high, we definitely want to reduce that. Sometimes all you have to do is change your food. Sometimes you've got to do, maybe parasite detoxing. Maybe you've got pathogens in the bloodstream that's causing this. It is nature's response to inflammation. So we want to make sure that your inflammation stays down. Now, your HDL, like I said, that is your good cholesterol. And if that is, we want that to be over 60 on your blood work. And that shows that your liver is working properly. And so we want to see that that is happening. So there was a featured study published in the Journal for Nuclear Medicine, and it involved people with mild cognitive impairment. And it looked at the effects of two types of statins, the hydrolytic and the lipophilic statins. Okay. So and they're giving you all kinds of brand names, which we don't care. We don't care about the brand names, right? We don't care about that. What they found is some claim that statins protect users against dementia, but others say that they accelerate dementia in the subject's use. So we don't want to do that. We don't want to accelerate that. People were divided into groups based on cognitive status, cholesterol levels, and the type of statins used, and they were followed for 8 years. Those with mild cognitive impairment and low to moderate cholesterol levels at the start of the study who used the lipophilic statins had more than double the risk of dementia compared to those who did not use those statins. So let me just give you the brand names of those statins so that you can know if this is you. So the lipophilic are Lipitor, Zocor, Lescal, Altoprev. Okay, those are the ones, and then the generic names, don't even ask me to tell you these generic names because I get them all mixed up. If you're on a statin drug, go to Google that drug, find out if it is one that works in fat, lipophilic, or if it is one that works in water, the hydrophilic, and then you're going to know what you have. Okay, so the people with mild cognitive development, okay, mild, that means that they showed a little bit of signs of dementia, but they could function pretty well. Their risk of dementia doubled over the 8 years if they were on one of these medications. The group also had significant decline in metabolism of the brain's posterior cingulate cortex, which is the brain's region that declines most significantly in early Alzheimer's disease. So we don't want Alzheimer's. Now, a lot of people will think that Alzheimer's and dementia are the same. They're not the same. Alzheimer's is a specific type of dementia. Dementia is like a catch-all word for cognitive decline, okay? Cognitive impairment. People think that that has to happen as we get older, but I'm here to tell you it does not have to happen. But for it not to happen, you have to be very, very proactive. Your brain needs cholesterol. 25 to 35% of your body's total cholesterol is found in your brain. This is an essential part of your neuron nutrients, all right? In your brain, cholesterol helps develop and maintain the plasticity and function of your neurons. And data from the Shanghai Aging Study published in Frontiers in Neurology revealed that high levels of LDL cholesterol, remember that's the quote unquote bad cholesterol, are inversely associated with dementia in those aged 50 years or higher. And the quote is this: high levels of LDL cholesterol may be considered as a potential protective factor against cognitive decline. the researchers noted. They compiled a number of mechanisms on why lower cholesterol may be damaging for brain health, including the fact that lower cholesterol is linked with higher mortality in the elderly, and it may occur alongside malnutrition and chronic diseases, including cancer. It is specifically related to brain health, okay, and they suggest decreasing cholesterol levels in the elderly may be associated with cerebral atrophy, which occurs with dementia. Now, cerebral means brain. Of course, y'all know that. Atrophy means wasting away. So your brain shrinks as you get older. That's just part of, I guess that's just part of the aging process. We don't want that to happen. And when you have very low cholesterol levels, the brain shrinks even more. And so that is associated with cognitive decline. High LDL cholesterol may be beneficial in reducing the neuron's impairments and helping to repair injured neurons. Acceleration of neurodegeneration has occurred when neurons were short on cellular cholesterol or cholesterol supply. Cholesterol plays an important role in the synthesis, transportation, and metabolism of steroid hormones, all right, and liposoluble vitamins. Now, liposoluble are your fat-soluble vitamins. So that would be your K, your D, your E, your A, all right? So you need to make sure that you have enough cholesterol in order to transport these vitamins where they need to go. It also transports your steroid hormones. What are your steroid hormones? Well, that's your cortisone, your adrenaline, all those other kind of hormones that we make that you need. And all of those hormones calm down inflammation. So we know that when the body is inflamed, the body will produce more LDL. Well, why? Because it has in it those nutrients that's going to calm down the inflammation. All right. In a U.S. study of more than 4,300 Medicare patients aged 65 and older also revealed that the higher levels of total cholesterol were associated with a decreased risk in Alzheimer's disease, even after adjusting for cardiovascular risk factors and other related variables. So, statin increase death risk for COVID patients. So this is something that is very, very important. It says the risks to brain health are only one red flag tied to statins. A concerning link was also uncovered among statins, diabetes, and an increased risk of severe disease from the current virus in a study published in Diabetes and Metabolism. Among the patients with type 2 diabetes who were admitted into the hospital with the virus, those taking statins had significantly higher mortality rate. That means they died, all right, from the virus within 7 to 28 days compared with those patients who were not on the drugs. So this is a pretty big study that they looked at, and so this is important. The researchers acknowledged that those taking statins were older, they were more frequently male, and often had more comorbidities, including high blood pressure, heart failure, and complications with diabetes. However, despite those limitations, the researchers found enough evidence in the over 2,400 participants to conclude that the present results do not support the hypothesis of a protective role of statin use against the virus, at least not in hospitalized patients. So this is really important, that the research is showing that this medication is not helpful, and in fact, it is harmful long term. The potentially deleterious effects of routine statin treatment on viral-related mortality demands further investigation, and as is recently highlighted, only appropriately designed and powered randomized controlled trials will be able to properly address this important issue. So thankfully, people are looking at the statistics. So if you are a loved one who is older, Medicare age and older, if y'all are on statin drugs, you need to really consider if this is your best health modality. Now, I'm not medical. I am holistic. I do a lot of research. We have on our webpage, which is my name, www.pollyheil-mealey.com. We've got a link. We've got a tab at the top of the webpage, links. One of the links is a paper by a professor at MIT, and he talks about cholesterol drugs, what cholesterol drugs actually do to your body, and why they may not be your best choice for controlling your cholesterol. So I want you to look at that. I want you to read it. I want you to make your own informed decision, because we are our own best health advocates. So going on in this article, they're talking about strategies for lowering your cholesterol. And he says a far better strategy may be preventing insulin resistance in the first place by avoiding statin drugs and eating a healthy diet. Well, when is the last time you heard somebody on the television when they're talking about your health, maintaining your immune system? When have you ever heard anybody recently talk about your diet? This is important. Why is that? Because your diet has nutrients in there that are called carotenoids, right? Carotenoids are antioxidants. Antioxidants go after the free radicals. The free radicals are the damaging particles that cause aging and cause disease. Now, we've been telling you this for a couple of months now, that we've got a scanner here in the clinic, and it's a very, very quick 30-second test that we can do. It's a $20 test, but you come in and we can actually tell you if you're eating enough fruits and vegetables to have enough carotenoids, to have enough antioxidants to take care of those free radicals. So really it all comes down to diet and what you're eating and how you're absorbing that food. You should be eating 30 different fruits and vegetables per week. Now, I know if you're like me, I've had to make some adjustments because I get in a rut and I like my asparagus and I like my broccoli and I like my this and my that and the other. I've had to reassess and make sure that we're getting 30 different fruits, 30 different vegetables, altogether 30 fruits and vegetables in the week. And you want the ones that are dark colored. So you want the red ones, the yellow ones, the orange ones, the purple ones. Those are what you want, because those have the highest number of carotenoids, and that translates into antioxidant benefit, which helps your immune system. So they're saying instead of doing a statin drug, change diet. So I'm agreeing with that. Dr. Asim Malhotra, maybe didn't say that right, who is an interventional cardiologist consultant in London, has been attacked for being the statin denier doctor after calling the drug's side effects and calling out the drug's side effects. And a colleague, this is a quote from this doctor, in young adults, preventing insulin resistance could prevent 42% of myocardial infractions, a larger reduction than correcting hypertension, 36%, low density lipoprotein cholesterol, HDL, and LDL, 31%, body mass index, 21%. It's important. It says it's plausible that the small benefit of statins in the prevention of cardiovascular disease comes from philanthropic effects, which are independent of the LDL lowering. The focus is primarily prevention, and it should therefore be on foods and food groups that have proven beneficial in reducing hard endpoints and mortality. So this is a medical doctor in London who's saying we can control your cholesterol with your food. Decreased cholesterol levels in the elderly may be associated with cerebral atrophy, which occurs with dementia. We said that. Even as saturated fats and cholesterol have been vilified and the statin drugs have become among the most widely prescribed medications worldwide, heart disease remains a top killer. Today, statin drugs to reduce cholesterol levels are recommended for 4 broad patient populations: those who have already had a cardiovascular event, adults with diabetes, adults with LDL over 190, individuals with an estimated 10-year cardiovascular risk greater than 7.5%, which is based on an algorithm. Despite, this is a quote, despite statins being prescribed for these sizable groups and target cholesterol levels being achieved, a systemic review of 35 randomized controlled studies found that no additional benefits were gained, according to the analysis by the BMJ evidence-based medicine. And this is the quote: recommending cholesterol lowering treatment based on estimated cardiovascular risk fails to identify many high-risk patients and may lead to unnecessary treatment of low-risk individuals. The negative results of numerous cholesterol-lowering randomized controlled trials calls us into question, and it is a problem, and we need to reevaluate the validity of using low-density lipoprotein cholesterol as a surrogate target for the prevention of cardiovascular disease. So this is good if you're doing cholesterol, and a lot of people don't know why they're doing cholesterol medicines. They say they're doing it because their doctor told them to. And I appreciate that. And I understand that we need to listen to our doctors, but we also need to be our own best advocate. And so we need to ask the doctor, what is the benefit of my taking this? Why do I need to take this? What do the studies show? And if the doctor tells you something and you need to verify that, then, I mean, the World Wide Web is a wide open library, and you can go and you can verify that, or you can look at some alternatives, and you can be your own best advocate. And this is what we need to be, because we have to live in this body. We want this body to take us where it needs to go. We want this body to be around for a long time and healthy. And so if my doctor has told me to take a statin drug to reduce my cholesterol, he maybe not have told me that, well, you're going to take this and you might not have a cardiovascular risk, but you're going to get dementia, or you're going to die if you get the virus, or you're going to develop diabetes. Those are not outcomes that are okay with me. So is your doctor telling you all of the outcomes? And if not, you need to ask. And sometimes they don't tell us because we don't ask. Okay. A lot of times, and I've had this happen myself, I research before I go to the doctor. I research before I go with family members to the doctor. And sometimes I know things that the doctor doesn't know that I know. And when I ask a question, the doctor kind of, looks at me like, how do you know that? And I say, well, because I research, and I research scholarly articles. So I research PubMed. I research anything that has an extension edu, because it's from a university, a teaching hospital maybe. So you want to make sure that you're not just looking at anecdotal evidence, that you're not just looking at people that pay people to say what they're supposed to say. You want to look at verified, non-biased reports so that you can make the best result or the best choice for your own health. So statins, we're going to finish with this. Statins are effective at lowering cholesterol, but whether this is a panacea for helping you avoid heart disease and extend your lifespan is a topic of heated debate. In 2018, a scientific review presented substantial evidence that high LDL and total cholesterol are not an indication of heart disease risk, and that statin treatment is a doubtful benefit as a form of primary prevention for this reason. In short, these drugs have done nothing to derail the rising trend of heart disease while putting users at increased risk of health conditions such as diabetes, dementia, and others, which include cancer, cataracts, triple risk of coronary artery and aortic artery calcification, musculoskeletal disorders, including myalgia, muscle weakness, muscle cramps, rhabdomyolysis, not sure I said that right, and autoimmune muscle disease, also depression. If I had a penny for everybody that came in here this week that told me they were depressed, I'd have a lot of pennies. All right. Depression is pretty rampant right now. How many of those people are on cholesterol medicine? Well, it's hard to tell, so we don't deal in medicine, we deal in health. But these are some things that you need to know if you're dealing with people or if you yourself are taking cholesterol medicine. It says, in the event that you are taking a statin, be aware that they deplete your body of CoQ10, which inhibits the synthesis of vitamin K2. Now, why do you need vitamin K2? You need vitamin K2 to absorb your vitamin D. And we know that having a lot of vitamin D will help you if you get the virus. We know that vitamin D helps your immune system. We know that when you have enough vitamin D that you're not going to be depressed. So there you go. You've got it all again, right? These vitamins are very, very important. And your LDL transports these fat vitamins where they need to go. So make sure that your cholesterol is not too low. I had a lady that came in today and her total cholesterol was 53. What is my number? My number is around 200. So she is not making enough cholesterol for her brain. She's not making enough cholesterol for her hormones. I don't really even know if she's making enough cholesterol for all of her cellular membranes that she needs. If you are a gentleman or if you are related to a gentleman, which of course all of us are either one or the other, it's binary. Okay, I'm just saying. If a man lowers his cholesterol to under 160, that gentleman is probably going to have problems with testosterone. He's not going to be able to function as a man because he doesn't have enough cholesterol to go around. And so these are some things that we need to consider when we're looking at medical intervention. All right. You want to supplement with CoQ10 for your heart if you're over 40. All right. So these are very, very important things. Hopefully you've learned a lot. All right. Cholesterol is not to be vilified. I had a lady that came in this week and she said her cholesterol was a little bit high. It wasn't high. I looked at it. It was fine. But her doctor had told her that it was too high and not to eat eggs. She loves eggs. And I said, well, the cholesterol that's in the egg is a different kind of cholesterol that your body makes. Okay. So remember, the takeaway I want you to have for today, if your LDL is high, it's because you have an inflammatory response and the body is making more LDL in order to put a Band-Aid on the inflammation. Do I want you to have high LDL? Not necessarily. But if you have a high inflammatory response, you're going to need that LDL to transport those steroid hormones, to transport those fat-soluble vitamins to calm down the inflammation. So get the whole picture. Hopefully this was not confusing for you. Hopefully you came away empowered and not being afraid of your cholesterol number. Remember, there's 3 components. There's your overall number, then there's your LDL, your HDL, and your triglycerides. If your triglycerides are high, that does portend to cardiovascular events. So we want to make sure that that comes down. But if we get rid of the inflammation, it all gets where it needs to be and you are balanced. Cholesterol is your friend. Cholesterol will protect your heart. It will protect your brain, and it will protect your body if you come in contact with a certain virus. So love you guys. It is the weekend. Take care of yourself. Do a lot of self-love. Go ahead and share this. Give me comments. I've seen a lot of hearts here, so I appreciate that. We love, love, love when you share this. And I appreciate the half hour that you spent with me. And I will see you again next week. Take care.